just start off with a brief question for you. Now, it's more than 6 months into the pandemic. The coronavirus has infected more than 1.40 crore people worldwide, killing almost 6,85,000 people, 6 lakh people. But the silver lining is that 85 lakh people have recovered so far. But despite the increasing toll, scientists still do not have a definitive answer to one of the most fundamental questions about the virus. How deadly is it? What's your take on this, doctor?
I think what we've learned over the last 6 months is that our knowledge is still ongoing. And what started off simple as a viral illness, which was like any other viral pneumonia, which was affecting the lungs, from there, our understanding has gone on to understand now a simple viral pneumonia. It also causes long-term thrombotic effects. It causes, what we call the cytokine storm, which can be absolutely lethal. The second part, what we've learned so far, is that it's still a very deceptive disease. And every day we are finding reports from across the world which are telling us that new and new symptoms are coming in. For the first 3 months, nobody ever thought that, not being able to smell properly or not being able to taste properly was a symptom of COVID. And now it's one of the commonest things to present, in the outpatient. When you ask somebody, he says, yeah, I can't smell. So it's a knowledge which is evolving. We are better off now than we were 6 months ago. I think we understand the disease a lot better. We have a lot more drugs which are available for different stages of the disease, mild, moderate, and severe. Our outcomes are better. But what is worrying is that the numbers are not coming down. The proliferation of the disease across the world, across community is extremely high. And, we've now heard a new word called the pandemic fatigue. Everyone is tired, so people are stepping out. People are, losing caution. They're keeping masks, away. They're having social parties. So I think we need to still be careful that though we are understanding the disease, if we do not control it, then it is only going to continue without any control whatsoever. So human nature will have to bear this, difficult period for another few months. Hopefully by end of the year, we'll have somewhere close to a vaccine. And I think that will then be the time when we can breathe a sigh of relief and say that, we've probably overcome the disease in some manner.
The latest finding is that, and of course, one of the, members also have, the viewers have asked, yes, the WHO has said that, after a research, of course, that the virus can also be airborne. What exactly is this? Airborne means in the sense that it's there everywhere?
So, conventionally, you remember if you had a common cold, everyone told you to, whenever you sneezed, you were asked to put a, handkerchief in front of your mouth. Because when you sneezed, there were a lot of droplets which would go into the air. And those droplets would be inhaled by any person who walked, was directly exposed to it or came into that room or into that zone of area in a finite period of time. So if I came into a room and somebody had sneezed heavily, then there was airborne things available in the air which I could inhale and become sick with. When the initial disease came up and COVID infection was being done, we believed it was droplets which would drop. If I coughed, it would be drop on the floor, it would drop on the table, it would drop on this thing. And then I would, then be able to do something about it. But now we are saying it's not only droplet, it's airborne. It's like any other cough, cold, pneumonia. So that's a different mode of transmission, and which has further highlighted the extreme importance of being able to put a mask on your face. Because if you don't put a mask on the face, then this airborne infection can go back and forth even more.
Now, Dr. Suri, one question is, which I'd asked earlier on to Dr. Tarun Sahni, is that despite 6 months, the virus is still a mystery. How far have we solved this mystery? Do we still have a fair enough knowledge? How do you say that?
Yeah, we are definitely better today than what we were in say January and February, and will be much better after 2-3 months, because we are today practicing what we have learned in the last 3-4 months. And we will continue to learn as we practice in the next 3-4 months. Our knowledge will keep evolving. The new research will keep coming. There are so many trials going on. There are so many observations going on. So the information is continuously pouring in, and we are becoming wiser and wiser. There is no doubt about it. But one thing is pardon me,
Yeah, one thing that we have seen across India is that this virus exploded in Mumbai, in Ahmedabad, in Delhi, and all these places are showing slow signs of of tapering down. And now, since it is now sort of herd immunity is building up, this virus is now moving to other places like Bengaluru, Chennai is of course there. The surprising thing is even Trivandrum in Kerala, which is the capital, you see a lot number of cases happening, and they have declared their first community spread in Kerala in these two places in Trivandrum. So there is a journey of this virus. So how do you think this virus will go around from big cities to towns to villages and then vanish?
Yeah, definitely it will go like this, because India is a large country, and first it will happen in those big cities where there has been too much of traveling. A lot of people have been coming in. So you can take India like many European countries, and the big cities like Mumbai, Delhi, Kolkata, Chennai. So all these cities, you know that there is a lot of economic activity, there is a lot of travel around this. So the disease entered from foreign countries into these cities, and then there is a gradual, what you can say, growth of this viral replication, which takes, initially it is very slow. The first 1,000 may take say 1 month, the next may take only few days. So it's a logarithmic multiplication or replication of the virus, and that is what we are seeing. So Delhi, first we had Mumbai. So Mumbai is the financial capital. Then we saw in Delhi, which is the political capital. The number has been gradually increasing. If you look into the natural history of an epidemic or a pandemic, it will terminate by two means. In fact, 3-4 means by which the epidemic will terminate. Number one, as Dr. Sahni was mentioning, when there is a significant number of people get infected, and that we calculate according to the what you call the R0 number. We have a formula of R0, and with that you calculate. So if you use the R0 of say COVID-19, then the herd immunity percentage would be something around 60%.
Focusing on COVID-19 because that's what we're living with. There have been various other infections. Dr. Sahni spoke about the SARS, the H1N1, the MERS virus. Many times what happens is that in modern medicine, all the conversation, all these 10s and 20s of years that we've attended sessions and conferences and talks, all the conversation or spoken, we've always been speaking about non-communicable diseases. The focus has been on diabetes, on cancer, on hormonal imbalances, on kidney failures, and many other non-communicable diseases. Infection has not been something that has been talked about too much. There's not been enough, deliberation on infection, because infectious diseases it was supposed that we have developed the medical infrastructure and the science to fight infections, So we said, listen, malaria, we have a medicine for it. We can test it, we can treat it. Listen, dengue, we know how to test it and treat it. You want to talk about flu, we know most of it. We have vaccines for a lot of influenzas A and B. But with this pandemic and also with SARS and other ones, what we've realized is there's another category of diseases that we are not probably talking about so much, which is infection. And now, of course, it has become the conversation everywhere in center stage. So if I have to save myself from infection, or I do not want to fall prey to an infection, mostly a viral bacterial infection, my only armor really, besides the social distancing, mask and so on, my real armor is my own health and my own body.
Treatment gap for psychiatric disorders, for neuropsychiatric disorders, including epilepsy, in India and South Asia is 80%. So out of every 100 people, if there are 10 people who can benefit from treatment, there are only 2 who reach any mental health service. 8 out of those 10 out of 100 never reach any mental health service. So that is not so good news. What happens in pandemics and epidemics and disasters and conflicts like this, Manjari, is that a lot of people from the treatment gap actually come for, the relatives realize or the person realizes and they come for treatment. So even if there is increase in attendance for diagnosable disorders at mental health services, that is not to be mistaken as a psychiatric epidemic.
On dealing with diseases, and we have Dr. Sanjoy Paul and we have Dr. Gaurav Thukral on our panel. Mainly this dealing with the disease, so the highlights would be, home solution, do's and don'ts, when should one get hospitalization, how to prevent cross-infection in family, tips to aid recovery.
You'll be surprised to know, sir, that 85% of COVID positive people are asymptomatic. And it's only that when their saturations fall below 95, they have a fever of more than 101, respiratory rate more than 24, and they're comorbid and more at risk that they need to be in the hospital. We have been managing the show for Delhi government now, thousands of patients, and with Fortis and many other hospitals, we have managed thousands of patients on home isolation who were either asymptomatic and mildly symptomatic, sir. And we have had a hospitalization rate of less than 1%. Home is where your family is, sir. We have heard in the last session that being with the family, all that psychological stress also helps to boost your immunity and fighting the virus. So I think with the guidelines in place and people now adopting telemedicine, where doctors and nurses and dietitian and psychological counselors are available round the clock to help you, to guide you, to let you know how to monitor, it becomes a very, very coveted choice. If I today become positive, I would really don't want to get to a facility which is alien to me, be there without my loved ones, my family, stay there isolated for next 15 to 20 days.
Any special things that you do for COVID, mild patients, mild symptomatic and mild symptomatic patients? Do you take any special care, especially if that house has a vulnerable, the age group people like old people? What do you do in that case? How difficult or what are the precautions that you take?
So, sir, first of all is to ascertain the eligibility of a patient to be at home or not. The first eligibility is that person should have a separate room with an attached toilet. If that is not a problem, then this person has to isolate somewhere else, maybe in a hotel or a guest house if allowed by that state government or in a government facility. Second thing is that all people who are vulnerable, maybe it is a elderly individual, somebody who has diabetes, hypertension, CVA, COPD, asthma, or a pregnant woman, all these people have to be segregated from this individual, including that the caregiver of this person should not be from the vulnerable group.
What are the early symptoms? Dr. Gaurav has mentioned about this. What about the early symptoms that you see in patients in COVID patients? Please unmute yourself, Dr. Sanjoy Paul. I cannot hear you.
Normally, we can see fever is a flu kind of symptoms actually, fever, cough. Okay, from mild fever to high grade fever we have seen, but some of the unusual we can find lack of taste, lack of smell, anosmia where I am seeing some of the patients, that mild body pain, some kind of myalgia. And last 10 to 15 days, I'm seeing some kind of cases who have only diarrhea. They don't have any fever. Sorry, they don't have any fever, but they have a diarrhea, 4 to 5 times diarrhea, and a body pain and the lack of taste. And this kind of symptoms I'm getting normally at my clinic.
And one question that has been asked by Abhishek is that does loss of smell and taste indicate COVID early symptoms? I think Dr. Sahni, you can take that.
Yeah, so for a long time we did not recognize the fact that anosmia and lack of taste was actually a exhibition of COVID, but it is now definitely one of the criteria on which you could diagnose that a patient is likely to have COVID. But the correlation from the existing data appears that the people who present with anosmia and with poor taste will actually have a milder disease compared to the others. That is what the consensus seems to be emerging, because most of them do not cross over to more than a mild form of a disease, and they recover extremely well. But yes, it is definitely now being identified as one of the symptoms and one of the early symptoms of COVID infection.
Thank you very much, Dr. Sahni. Thank you very much, Dr. Gaurav. Thank you, Manjari. It was a pleasure sharing the platform with you. We hope to catch up with you again in next seminars in the coming days. Thank you. And it was a big learning curve for all of us. Thank you very much. And good evening.
Thank you so much.
Thank you, everyone. I would also like to thank our partners, UGRO Capital, for this, who helped us organize this whole seminar. Thank you, Shankar sir, for hosting this seminar so wonderfully. I thank all our panelists and our attendees. We hope to connect with you with another scintillating information-filled session soon.